Yes, we are ready.
Okay, you guys, thank you for your patience these last few minutes. I'm Marcy Strauss with Capital Benefits Group, and you can hear Tracy behind the scenes. She's my business partner, Tracy Hitchcock, and we are super excited because we are celebrating our 5-year anniversary this year. So a lot of things to be thankful for. But one of the things that we really founded the agency on is advocacy and making sure that we really are looking out for all of our clients, whether that is our large, small employers, but then also our individual clients as well. So we do work in the marketplace, so individual policies as well as Medicare. Um, so I wanted to just kind of share with you guys, I was able to go out to DC last week for the NABIP Capital Conference, and NABIP is the National Association of Benefits and Insurance Professionals. And so there were about 1,000 of us from all over the country that came together, listened to some really amazing speakers just talking about all the issues we're having nationwide. But then also had an opportunity to really work with some local states that we know, for instance, Minnesota, there's a lot of stuff going on legislatively there. So it was a great opportunity for us just to learn more outside of the state of Iowa and what other states are dealing with. And I think it was very interesting to know that it is very similar. So even though every state has a different makeup and different needs, it seems like the topics are the same across the board. So I wanted to just share with you real quick, and then I'm going to turn it over to Jocelyn with NFIB. I really want you to hear more what she has to say, but I wanted to let you know what the things that we're watching very closely and working on here at Capital Benefits Group. So for federal legislative priorities right now, we do have the preserving and strengthening employer-sponsored health coverage. So some of you are probably feeling the pain with some of the ACA reporting requirements that are happening and the cost that's associated with that. And so what we are constantly voicing is that we love the idea of transparency, which is really where most of this stuff started. And the idea behind it is just to get transparency so we can get a handle on healthcare costs and access to care, and how our employer groups are really working and offering benefits to their employees. And so we do have some employer reporting requirements that we are working towards to help to create a better I guess opportunity for employers to not have the reporting requirements that are so challenging for a lot of you. Some of you might not be feeling this at all. Some we're handling for you, so you definitely, you know it's getting taken care of, but it is still a compliance thing that you are ultimately responsible for. And so those reporting requirements, it seems like, just continue to come at us, and we want to make sure that we really are addressing that and keeping the employer out of it. Most of this information that they're looking for should be coming from PBM, so our pharmacy benefit managers. It should be coming from TPAs and carriers, not specifically the employers. So that is definitely something we have been talking about for a long time, but we are continuing to work on that. We do have some changes that are potentially going to be adopted in this next budget deadline, which right now looks like it should be March 22nd. But it's a little bit of a moving target at this point. So that is one thing. Addressing the cost of care is another issue that we're watching really closely. And, if you guys can kind of think back before the Affordable Care Act rolled out, we really had a lot of more independent providers throughout the state. We are a rural state. And so we have communities that have smaller independent providers. And now over time, they have been purchased or merged with a Unity Point or a Mercy, so our bigger hospital systems. And what we've seen come out of that, unfortunately, is price increase. And so when you're having tests done at one of those independent providers, you're starting to see facility charges being charged on top of just what the normal cost would be for care in those facilities. And so we're wanting to make sure that cost of care is equal and equivalent across the board, and some aren't getting dinged and others not so much. Bless you, Teresa. Um,
Sorry.
That's okay. And anyway, so that is one piece that we're watching very closely. So you might start to see something, in that site neutral conversation a little bit more in the news. HSA telehealth expansion just is a no brainer to me. So through the pandemic, what happened was they allowed telehealth to be set at a copay amount if you have a high deductible health plan. And today, in order for that to be qualified, you can't have office visit copays. You really, everything has to go towards the deductible first. And once that's met, then there could be plans that have copays afterwards. But the law is set right now to sunset the end of this year. And so what we're trying to do is just make this permanent, just allow for those telehealth services to be able to be provided at a copay amount so people can continue to use those. The challenge with that too is we do have a shortage of mental health providers, and this isn't just, for Iowa, this is truly across the country. And so that telehealth does give access to mental health providers where maybe some people in more rural areas, they wouldn't have access to a provider without driving, a distance for that. So again, we want it to get done sooner than later because there are employers that are already starting to work on benefit plans for the next year. And if carriers don't know that this is something that is going to be allowed, then they start to build plans that do not allow it because they're looking towards plans that right now are not approved for 2025. And so we just want it to be permanent, but we want them to make a decision now. We don't want them waiting around and then all of a sudden everything has to be changed. And it could also impact premiums at that point too. So that's another thing that we're watching, transparency of healthcare costs. So this kind of goes back even to that employer reporting piece of it. So right now, a lot of these this legislation is just trying to access what is everything costing us. And so we fully support transparency. We have got to get a handle on what is going on with healthcare costs across the board, and maybe how some of these site neutral payments and things can be addressed to make sure that we have that. But nothing else in our world do we not have a number up front on. I don't go to the grocery store and not know how much my eggs are going to cost until I go through the grocery line and pay for it. I don't buy a car without knowing exactly what that cost is going to be up front. However, in healthcare, in a lot of cases, for those larger claims, those larger things that we're having done, we don't have a clue what it's going to cost us until after we get that invoice from the provider. And so we want to make sure that transparency really is something that we're focusing on. So we're working on that, trying to get that information without, again, burdening the employers to be a part of that process of supplying all of that information, because most of the time you need to go to the TPA or the carrier to get that information anyway. The last piece on the federal side of things that we really talked about is Medicare. Medicare right now is, we have a lot of people aging into Medicare. It can be very complicated. Social Security can be a complicated process for Medicare eligible participants to even get through. And so I know, Tracy and I work really closely with our Medicare clients to make sure that they are getting signed up appropriately. And they don't have a whole lot of help and support from the Social Security Administration when they're doing that stuff. And so what we are asking as an agent, those of you that are not in that Medicare space, what is interesting is there was a regulation that came out, a year or so ago, where we have to, if we're not face to face in a meeting, we have to actually record every phone call or every virtual meeting that we're having, where we are talking about products that we would potentially be changing a client to. So if we're looking at a drug plan and we think there's a different drug plan that's better for them next year, any of those conversations we're supposed to be recording and then keeping for like 11 years. And so you can understand that that can be a little bit of a challenge, especially for smaller agencies. But then too, why do we have to do that as a licensed certified independent agent? We go through certification every single year. We have to certify with every carrier. Most of our clients are recurring clients that we have. So, if I've had a client for 15 years, why do I have to record a phone conversation or a virtual meeting with them when they know who they're working with? The idea of this came from call centers, unfortunately. People were getting a phone call, getting enrolled into a plan that was not appropriate for them, and then making some sort of a grievance, which they should be. But again, that's not how those licensed independent agents are working. We are very educated and ready to take that on and make sure that we're really showing that all the options to our Medicare clients. The next piece to that is right now, not through legislation, but from CMS regulated guidelines, they are proposing changes to our field marketing offices. And you're going to see FMO whenever this is brought up, and that is what an FMO is. And again, just mentioning, we do have a lot of small rural towns, areas. We have agents in those areas that are serving their clients, serving their communities, serving their family members and friends that are right there in their communities, and they don't have resources to go out and buy software that can compare all of the plans, that can help them to, answer questions or challenges that they might be having on a claim for one of their members. So these field marketing offices are very, very important. We use one here at Capital Benefits Group. It actually allows us to compare all the plan choices. So anything that's out there and available to our Medicare clients within their specific area, we can look at every single plan that is available to them. If we get rid of the field marketing offices, the idea the government is wanting to get rid of the middlemen, but they're not understanding that this is going to push that burden then into the carriers. And now the carriers are going to have to figure out how they can manage this. And there's a good chance that we could actually see carriers leaving the Medicare market because it's going to create more of an administrative burden on the carriers. And it's also going to make those smaller agencies not have access to those same resources. So we could see some of those agents just pull out of the market as well. And we need good people taking care of people within their own communities. So this is, again, something extremely important. It does not, it's not one of those things where if we remove these FMOs that all of a sudden premiums are going to come down. That's not going to happen. The other thing too on this, just real quick, which got thrown in, it wasn't really a priority. However, it was a conversation that we were having, is that right now, if you're on a Medicare Advantage plan, our Medicare beneficiaries have this open enrollment period in January and February for a January, February, and a March effective date, which allows them to make a change at the beginning of the year. And so even though open enrollment is typically for that January, it gives them kind of that second opportunity. So if a drug formulary changes and maybe one of their prescriptions is no longer on the covered the same way on the plan that they have, they can go in and actually make a change. Well, what we're trying to do is to also make that available for drug cards, so Part D plans. So then that way those same members have that opportunity, because we are seeing that happen. We are seeing formularies change, and then all of a sudden somebody's medication is not covered. And so that again is something that we're watching. Is very important to us. So moving on. As you can tell, I get very excited about this stuff. So if you ever want to have a conversation, I'm happy to talk all day, but I'm trying to get through this so that we can turn it over to Jocelyn. So thank you for your patience on this. So state legislative priorities right now in the healthcare space. We are watching this Senate File 2081, which is a Medicare supplement birthday rule. And so basically today, if you are on a supplement plan, you would have to go through underwriting to make a change to another carrier or to another plan. And what this is wanting to do is eliminate underwriting. So that way, your birth month, you can just make a change anytime you want to. And although this sounds really good, what we have seen in any of the states across the board nationwide, it has increased the premiums for everyone. So I did a comparison that showed in Iowa the lowest option for a 65-year-old female today for Plan G, which is a very rich plan, is $90. And we were looking in some of the other states, it's closer to $140, $150 in these states. And so that's a huge discrepancy when you're looking at those numbers for that younger population. We do have opportunities to move people into Advantage plans that are very good and can help them if that premium gets so high that it is unaffordable for them in the supplement side of things. And so we're watching that legislation and giving input on that. Pharmacy benefit managers' prescriptions are insane right now. And I'm sure, this is probably something that Jocelyn's going to touch on. But in Iowa, we have two different PBM bills that are going through. One of them we support fully, and it is one that is being driven by the insurance division, which is this House File 2099 and then Senate File 2357. This is just, again, for more transparency. Right now, we don't have all the information. We don't know how contracts are set up or how reimbursements are set up. And so the insurance division actually for the last 2 years has been gathering data based on legislation that passed a couple years ago, but now they need access to more information. And so that's what this legislation is going to do, is it's going to allow them to be able to access contracts and look at some of those pricing models that right now the PBMs are saying are proprietary information. And so we're actually really excited about that, because the more information we can get, we will actually be able to get to meaningful legislation so we can help to bring some of these costs down and make sure we're taking care of our local pharmacies, because right now that's a big challenge, is keeping our local pharmacies open. And then the other one that we're watching is House File 2401. This one is also based on, the pharmacy benefit managers, but it does something that eliminates spread pricing. This is really going to impact more of those larger employers. And the only thing I can say about this is do not eliminate options for employers. Right now, you're doing everything that you can to try and keep costs down and still provide really good quality benefits for your employees. And if you prohibit an opportunity that might actually financially make sense for you, then again, it's just going to increase costs on that. The other thing too is the appeals process. Unfortunately, it's set up so then that way that maximum allowable reimbursement then across the board. So if somebody appeals it, it's going to change the rate across the board for everyone. And I know that in certain areas they're getting reimbursed at a much higher rate than other areas. And so we're just afraid of that appeal process and letting it set precedent that, again, everything that we focus on is cost of care. Any of you that are on this call today know that our healthcare costs are getting out of control. And so we have to be super thoughtful and engaged in all of these conversations. And we have to look at the big picture. We have to look at the entire population and not just certain areas that might benefit from something. We have to make sure that it makes sense for everybody and is not going to increase costs for all employers or for all individuals, as I was talking about the Medicare piece of that. So again, a lot of things that we're following and watching. And if you guys see anything that pops up in the mail, in the newspaper, I know a lot of you probably have the business record. So if you're seeing any of that and you're just curious about it, I'm always happy to have a conversation. Shoot me an email. I promise I will not talk your ear off. I will give you the answers that you need and not take up too much of your time. However, we're super engaged and involved in trying to do as much advocacy as we can for our clients. So with that, I am super excited to introduce Jocelyn. Jocelyn is a principal of federal government relations at the National Federation of Independent Business. So those of you that are NFIB members today, awesome. If you're not, I would highly encourage you to look at that because they provide a ton of information specific to employer groups. She is responsible for leading the organization's efforts to represent the interests of small businesses in the healthcare policy arena, promoting policies that result in affordable, flexible, and predictable health insurance options. Jocelyn received her bachelor's degree from Virginia Commonwealth University and began her career at the Virginia State Legislature. Her experience extends to operating operating several family-owned small businesses and helping found several local nonprofit organizations throughout her career, demonstrating her commitment to public service and advocacy. So I'm going to turn it over. I have had so much fun working with Jocelyn. She is extremely knowledgeable and she is always looking for feedback. So there could be times that I might reach out to one of you to get feedback specific to your group. So with that, I'm going to mute myself, turn off my camera, and welcome, Jocelyn.
Thank you, Marcy and Tracy. I love, Marcy, you are so passionate about what you do. We're lucky to have you in this fight for your clients, for our members at NFIB. My name is Jocelyn. I'm one of our lobbyists here, and I focus mostly on healthcare. NFIB is an organization that has been longstanding for 80 years. We were actually an offshoot of the U.S. Chamber as a way to have a voice for independent and smaller businesses, not corporations. Everyone needs representation, nothing against big corporations. And so we focus on issues that really impact a majority of our members that do not share industry commonality, but they share size. So 80% of NFIB members employ 20 people or less. So you're thinking really small firms across the wide sector, construction, PR, auto repair shops, we have bakers. I mean, literally, we have people, all walks of life and all types of industries. But regardless of the industry you're in, if you're that small, you probably have the same pain points. And that's what our data for 50 years has shown. You struggle with taxation, with certain regulations from state and federal levels, because a lot of our members lack the infrastructure, like massive compliance departments, litigators, attorneys. And so they're exposed to sometimes pretty big agencies that may come after them on certain mistakes or certain regulatory items, as well as labor, and then healthcare costs. Healthcare costs have been the number one concern for our members for nearly 40 years. They've ranked the cost of insurance for themselves as the owner, because they're not working for a big company that offers a group health plan, but also offering it to their employees as a way to recruit talent. So healthcare continues and probably will be for a long time. It's just that tension that you have when you're that small and you don't have the ability to spread risk among, say, 140,000 people like Boeing can. So I'll give you a quick overview of what it is that we've been doing this year. If you follow the news, it's been a really interesting year. Some would say historic, unusual. We're having fun with it, but there's a lot on the line. I think we're in really interesting times for our community because we're seeing consolidation and amalgamation of industry market power across a variety of sectors, tech, definitely in healthcare, and how those regulatory frameworks that are becoming really heavy right now. We're seeing the most amount of regulation come out of a federal landscape than ever before historically. That really could hurt the barriers to entry for innovators that are small entrepreneurs, mid-sized and small businesses to grow. And so we're fighting every day for the right of our members to own, operate, and grow their businesses with not as many barriers that kind of give the larger incumbent an advantage. I'm wondering if you can see my presentation.
I can see it. It looks like it's in PowerPoint mode. So I don't know if you have to hit the presentation at the top left. Yep. Scooch over to the left a little bit here. You can see there's like a little screen over.
Yeah? No. Sorry. Okay. We'll see if that works or if it's too small percent in Teams. There we go.
I think it's okay, Jocelyn, too. I think otherwise there's that view and then you can go to there you go.
Yep. Perfect.
Sorry. Oh my gosh. So legislative calendar, yes, March 22nd, the next deadline to fund the government from the last year. We're still negotiating spending levels from 2024. There are already people talking about 2025 appropriations. We've just been behind. We have divided government. The House is controlled by Republicans, the Senate by Democrats, and obviously we have a Democratic president. So there's not a lot they're agreeing on. That's resulted in continuing resolutions but with continuing resolutions, you're not really funding programs or establishing new policy or really doing the heavy work the government is supposed to do. You're just simply kicking the can down the road. So right now we're trying to see what might come about in March 22nd. Is the next big deadline for a spending package. We're also from there, we're going to go into campaign season. It's a presidential election year, so we're not expecting transformational big changes. This is a year where Congress really starts messaging, trying to get on the campaign trail. So they'll start passing bills that they can go home and say, look, we try to, gun control, abortion, I don't know, whatever. It's really sex and border security. It's kind of a big deal right now for certain voting blocks. And so I would expect a lot of that, which means a lot of NFIB priorities probably won't have a chance to move in a vehicle until December. And then definitely in 2025 when we have a new Congress. And so even if Congress is focused on bickering or fighting each other, we are always working and educating and laying the foundation and getting scores and trying to get legislation lined up for when it can move. So our work never stops just because the screens are, focused on things like a Hunter Biden trial. The things that we'll be watching mostly for this year are tax issues. We have labor matters coming out mostly of the administrative regulations, and then of course healthcare, which Marcy covered, so I won't go too into depth with that. The NFIB agenda, it's pretty reasonable, but I think at the top of that for us is taxes. We are facing a cliff, and for those of you who work with small businesses or you yourself are a small business and you are set up as a pass-through entity, so you're not incorporated and you get your income and your revenue through your individual side, you're not in an incorporated tax setup. You're an LLC, you're a partnership, you're an S corporation, however you're set up, you will have a 20% tax hike at the end of 2025 because a law went into place in 2017 that cut a lot of taxes for both corporations and pass-through entities and individuals and a whole host of other things. And those are all expiring. And it will be a political nightmare to kind of wrestle with the various other industries and interests that will want to have their piece extended or made permanent. And it's a very expensive proposition. What we call the small business deduction, that is an actual deduction that helps pass through entities, which 95% of all small businesses in the country are actually not incorporated. They're set up as a pass through entity. That means, though, that here in DC, you're not going to have Intel and Verizon and Boeing throwing money at this issue and lobbying. It's really just us. We have friends in the roofers, construction, some restaurants. We work with what we call the Main Street Coalition to try to build support for this and not be left behind. So that will be probably our number one priority just because of how much it impacts the entire NFIB membership. I think 85% of our members are pass-throughs. We do have a few small incorporated members because of historically that's how they were set up, but the majority are pass-through. So they will be facing a huge tax hike. We communicate that we should not have unnecessary regulations. Regulations are good, but some are unnecessary. They're also not in parity. So there is such a thing as the Regulatory Flexibility Act, which says if you're going to pass a new regulation out of the Department of Labor, the EPA, OSHA, name your favorite or hated agency, you have to do a cost analysis of how it impacts the smallest firms in the country. Because at the end of the day, a massive corporation like Amazon and NFIB members do not have the same resources to be dealing with those types of regulations. Right now, the level of regulatory environment that we're seeing is not taking into account the economic effects on smaller businesses. And so we are engaging the administration, we're lobbying them, we're putting out studies. Sometimes we engage in litigation where we can, and we will sue a certain agency or a department or the administration if we think that they've violated the law by not taking into account the economic effects of certain rules and regulations. We're looking at a credit card bill. Basically, if you're a retailer or you work with retailers, credit card fees are a big deal. There's not a lot of competition in that market. So we're trying to increase competition on credit card fees. Death tax repeal. I know Iowa, this is big for farmers. When you pass away and you want to pass your estate down to your family, you have to pay tax on, it's called an estate tax. We want that repealed. And there's a bill by Rep. Feenstra that was just introduced. Reduce healthcare costs, reduce burdensome reporting requirements. If you are a business with 20 people or less as of January of 2024, thanks to the Corporate Transparency Act, you will have to file with it's called the Financial Crimes Enforcement Network, a whole host of information about who is a beneficial owner of your business. This was intended to prevent money laundering, to prevent terrorism, and maybe, cartels from having shell companies. The problem is that it is impacting every business with 20 or less people. And the fines, should you file that wrong, are anywhere between $10,000 to $100,000 or even jail time. So well-intentioned policy. I mean, all of these things are always well-intentioned, but the ramifications are pretty heavy. So we are working diligently to lower that burden, to get it repealed. We're looking at litigation, but that one's a pretty big one that just went into effect in January. And then a couple other things. Energy costs are big for our members that are in farming, obviously construction industry, manufacturing, regardless of it. If you are using energy, even in your own home, but definitely to do business, energy costs have been going up, which has resulted in our members having to pass that cost onto the consumer, which then feeds into the cycle of inflation. So looking at ways to maybe, permitting reform, like ways to lower energy costs and have more energy abundance. The state of the small business, it's a little bit shaky right now. We do these surveys every month. They're statistically significant. They're quoted in the Wall Street Journal. We have an economist in-house that does them. And every month we check the temperature of small businesses. It kind of, depending on the month, depending on what's going on, it changes. But right now we've seen the confidence of small businesses below the 50-year national average for like 25 months straight. And that's because of everything I just laid out, the cost of things, inflation. It's hard for them to hire people. And so I think they're just not feeling like the cavalry's coming, and that kind of impacts their optimism. Inflation right now is their number one issue. And that just means the cost of doing business. Things are just more expensive. If you're getting things shipped from another country, supply chain, things are getting delayed. It's just raising the price of doing business. And a lot of them are planning to stop filling the positions that for months, if not years, they've been trying to fill. So we're not seeing anything recession-like at all, but I do think that things are slowing down a little bit. Our owners wanted to fill as many positions as possible last year. I think some of them are they wanted to scale up. They wanted to, buy maybe that third franchise or what have you. I think they're staying put right now and trying to figure out what the economic conditions will be in a future. So I'm not an economist. I don't know what that means, but we do track that sentiment. I covered the tax issue. This is what NFIB has been doing for years, and definitely all year this year, is educating members, educating anybody who's a pass-through business, educating members of Congress on the impact of a 20% tax hike on small businesses if the small business deduction expires. Most people here in DC were not here when this law passed, and so none of them know what it even is. So half of our job is just explaining over and over again. Section 199A of the tax code, Section 13 in your tax form if you're a business owner. That is where you can get up until a certain threshold, 20% deduction on your expenses, especially if you're an employer. And that's obviously expiring. So our call to action to NFIB members is to make your voices heard. Tell us, how have you used that tax deduction? A lot of people use it to bring back healthcare benefits. Others bought vents. They upgraded their, kitchen equipment if they're a restaurant. Others, just started hiring more people. So however stories you have, or if you want to reach out to your members of Congress, this is a huge priority, along with the death tax repeal. Separately from this, there's a tax bill moving. You'll hear in the news, and it's a smaller one. It's bonus depreciation, it's research and development. If you have clients or partners in the manufacturing space, especially drug manufacturing, that's a big one for them. Chip makers. We endorse the tax bill that is moving through right now. It's a compromise, a bipartisan compromise. It just doesn't impact as many of our members as these individual tax issues will at the end of 2025. So a lot of tax, but we look at it and just say what will have the biggest impact on the most amount of members at the highest levels, and that's where we're going to put our energy. Okay, let's see if I can keep going. Labor issues. We have a couple rules coming out of the administration that are concerning. There are a lot of regulatory actions, but again, looking at the NFIB type of makeup, overtime rules, independent contractor, and joint employer. Overtime rule would basically say if you have employees that make more than a certain amount of money, they're administrative, managerial type of employees, they make $55,000 a year, they will also qualify for overtime. They will not be exempt. That means that you have to pay that salary plus overtime, which will cause a little bit of distortion in how you classify your employees, especially your managerial employees that aren't hourly workers. Obviously, this is intended to be pro worker, but always trying to balance that, especially with smaller firms that may, have freedom of association with their employees. This will be a pretty big lift on a majority of NFIB type members. Independent contractor. If you work with independent contractors, the classification, it's freelancing. This is seen in construction and PR. There are a lot of, it's not just Uber and Lyft drivers. There's a lot of people that work through that 1040 arrangement. This would make it harder for businesses to hire independent contractors. They want people to be full-time employees as much as possible. And in some cases, that probably is correct and should be the case. If the business is misclassifying, there already is a test in place to see whether or not somebody should be an independent contractor or a full-time employee. This new rule just makes it that much more ambiguous. It would empower the Secretary of Labor to determine when a business is violating this very ambiguous new test. If you're from California, you've heard the AB5 test. This is kind of similar, not as bad as California, but kind of getting at the same idea. And we are incredibly worried about it. And joint employer, this one doesn't impact all NFIB members, but if you're a franchise owner, you usually negotiate with your employees as you might be a McDonald's franchise owner, but you don't work with all McDonald's across the country. You have you're kind of a small business owner in a way. You just own the franchise. This would allow employees to collectively bargain as an industry nationally against each of the owners. And so it would basically say you're a joint employer, even though you're technically an independent franchisor. Again, getting back at the collective bargaining, which I think is not necessarily a bad thing, but it does have repercussions on where wages might end up in a place like Iowa that isn't necessarily at the same standard or level of pay as California and New York, and having this sort of national type of blanket labor ability for people to collectively bargain, or to see everyone as one big joint employer across the country despite regions, it could end up impacting wages and hiring, employment, etc. Lastly, this is my favorite one. Obviously, I work in healthcare. We want to lower healthcare costs. And Marcy touched on a lot of what's going on. But what people don't know is small businesses are fully insured for the most part. They hire 20 people or less. They're not ERISA type plans. And so here in DC, when they try to do healthcare things, they try to say, oh, this will help small businesses. Half the time it doesn't. What we really need is, as small employers, is pooling. We need to be able to have leverage when we're negotiating rates. And when you're so small against a giant of industry, you just don't have the leverage. You don't have market power the way larger employers do. So our number one priority is to allow members to bargain together, either directly contracting with providers or forming association health plans that are regulated by state level and federal level regulations. Or perhaps level funding where it makes sense, having the ability to do direct primary care arrangements on the side, in addition to your group health plan, health reimbursement arrangements. To get the point, which is we need a lot of choices for coverage. And right now, in the last few years, we've actually seen the choices for small employers diminish. And then you have your self-insured setup under ERISA, which really only favors larger companies with big risk pools and really big cash flows. Why is it important for businesses to offer healthcare? They don't have to. They're not mandated to because they want to. They want to take care of their employees. And also, it's a massive attraction tool for top talent. And if they cannot compete with the benefits of a larger employer in their area, they're probably going to lose out. There is a competitive argument that we make. So pooling's our big issue. We did have a bill move through, and actually Marcy was very helpful, that would expand HSAs, HRAs, sensibly expand AHPs, association health plans. That bill passed out of one chamber, probably won't go anywhere in the other anytime soon. But these are some of the things that we think, depending on what happens in the election, depending on what the makeup is of Congress next year, we might have a chance to move. And then employer reporting improvement. We have way too many employers that are dealing with the full force of the IRS when they don't have the compliance departments to be able to dispute those fines. So the Form 226J, that is sent preliminarily to employers. If the IRS thinks that there might be a discrepancy on their shared responsibility, and that they haven't been offering affordable health care to their employee, a lot of times it's a clerical error. Either the IRS did not do the right matchup between the employee's individual tax filing or the employer, or maybe the employer filled out the forms wrong. They put the thing in the wrong box. And that can result in hundreds of thousands of dollars in fines that maybe at the end of the day you won't have to pay, but you have to hire an attorney, especially a tax attorney. They're not cheap, and then go dispute with the IRS for months, go back and forth. And it's a huge burden, especially on people of our size. So trying to get those streamlined, modernized. And then, of course, transparency, hospital transparency, PBM transparency, empowering employers with information so they can negotiate the best deal, so they can be good fiduciaries for their employees and take care of them. They need that information to be able to make the best decisions when they're designing their benefits. So that's the majority. I mean, I know I went through a lot very quickly, but that's the breadth of what NFIB looks at. We look at a whole host of issues. And then we engage where we think there's the biggest impact for small firms. So I don't know if you have any questions, Marcy, but I'll hand it over back to you.
Yeah, I didn't see any pop up in the chat, but if you guys have any questions, you can certainly throw them in there real quick, or you can follow up with us and we'll make sure we get any of your questions answered. But you were talking about that joint employer situation. And when we were actually in Grassley's office last week, he brought that up and he was just really hot and not happy about that. And so I do know that that has Grassley's attention. I feel like most of the time when we are going in and having conversations, whether it's with staffers or the legislators themselves, we have to explain what we do, who we are as agents, what our role is for our clients and things like that. So it's always interesting that we have people pushing through certain bills or legislation and not really fully understanding that trickle down effect. And so that's why I love, we love working with NFIB. We know that you're focused on that employer side of things, which obviously we are too. But, the idea is, like you mentioned, we have to look at this as the greater good. You know, if this is going to, help everyone across the board, we have to stay focused on those issues. And so a lot of times with any sort of bills that come out, it's emotional and it is hard. And we've all had issues. We've all had things that we thought we wished our insurance paid for, or, man, I really hate that my mom's Medicare supplement premium is this high. However, there's trade-offs to, having great coverage and access to care. And so we just love the work that NFIB is doing, and we appreciate that partnership with you guys and the opportunities that we've had to have conversations with legislators and with their staffers. So that's been extremely valuable to us. And I don't see any other questions that have come in at all. So I just really want to close up today by saying thank you so much for taking time. Again, we're here to have conversations with you. If there's anything pressing in your world that you really want your voice heard on, please reach out to us, because there's probably people I can connect you with to make sure you're having those conversations. So with that, I will give you back your day, and have a wonderful day. Thank you.